Hey, what's up, everybody? Good morning. I've been up pretty much all night. I didn't sleep, but uh, for some of you that may have checked out my GoFundMe page, especially for the people that are on GoFundMe that maybe have gone to my profile and see that I do have a GoFundMe and wonder why it's not active or anything. I created it. I didn't feel like I was finished with it. I still want to talk more, but I think I wrote enough about myself, and maybe I should just go and write some updates to let you guys and girls know what I've been doing, what I do every day, or the changes or anything. But I don't have an appointment until after the weekend, so I go in on the 27th on Monday. I do a full scan, a CT scan. I'm not gonna just scan like one area. This is gonna be a full scan. And I just completed my e-check-in to make sure that all my information and medications and all that was all set up and everything. So I decided not just do my check-in or just make sure that the information is correct, but actually log into my lifespan account and also show you what I see. I try not to log in as much as I used to. I would look at every test, every result of a test, everything, but I'm at the point now where I'm kind of getting depressed. So already have bipolar disorder. I was diagnosed with that when I was 20 years old, but it's depressing me to the point where I'm now kind of in this rapid cycling phase where I don't really sleep a lot. And when I do, I sleep for an entire day, and I'm pacing a lot, and I'm not doing well. I don't really have a supportive community around me. Put it like that. I'm pretty much alone. But I wanted to show you what I'm going to do for the next week. As you can see my calendar here. I really like this site because I can, if I don't remember something, I can always go back here and check it out. But on Monday I do my full scan. They have to see if I've gone from stage 3 to stage 4. So that's what that's about. Then I have a follow-up appointment with my doctor, Dr. Mantra Bagata, at the Rhode Island Clinic. Cancer Institute, I should say. And then I do my fusion on Wednesday. I usually go there on Wednesday. I do that on Wednesdays, and then I have to keep my, I have a chemo port, and then I have my medication that I carry around with me that's injected into me until Friday. So I carry around that little box with me. And on Fridays, usually like late in the afternoon, I go in and I take that off, and then I get hydrated. I get an IV bag just to get some hydration because I don't drink a lot of water. And then I'm good all weekend. I like it like that. So I don't have to have a nurse come over and take the bag off on a Saturday or Sunday or whatever. So that's pretty cool. But yeah, this is what I'm going to do for the next couple of visits, I guess. I do my chemo infusion on the 29th. CT CAT scan. Wow. Okay. Let's see. Okay, this is okay, maybe I do another one on December 4th, but I think this needs to be updated. I think they switched it. They went from here and made it closer to here. So maybe I need to call and check this out. Yeah, it should be, this is the same thing, I think. Because I'm going to do everything on this day. I made this one first, but they wanted it sooner. Okay, unless they're going to just go in and talk to me on that day. But anyway, I guess I'll find out. When I go to the doctor, I'll talk to the doctor about it. This is my doc. I'm going to see her not until next year. And, but yeah, this is what I already did this November 1st. So, as you can see, I have 40 messages here. I don't want to read everything. This is an important reminder. Yeah, this was the reschedule I'm talking about. Let's check it out. View instructions on your appointment on Monday. Test results. Don't want to know test results right now. The only test results that I'm really looking to read or talk to my doctor about, or I'd rather my doctor sit with me and talk to me about it, is the CT scans, because that's going to be the decision maker for me, whether that's everything. Everything's on this scan. I could go from being in stage 3, thinking that everything is in stage 3, and actually be in stage 4. They have to find out if I had any spread. So That's what this is about. And also they need to look to see if the chemotherapy that I've been taking has had any effect on the size of the tumor that I have. Okay, let's go and look at my conditions. It said that I have hypertension, but actually my blood pressure is normal, or can be low sometimes, but it's pretty much normal. I think that happens to a lot of cancer patients. If they had like have a slightly elevated blood pressure, when you take chemo, it seems to like just knock that out the park or whatever. It's like you're all normal again for some strange reason. But I had a slightly elevated blood pressure, but it's always normal whenever I go back. So I think that they're gonna still watch that. But usually when I go, I never have high blood pressure. It's never been extremely high, and it's always pretty good. My last probably six wow, it's been good for a couple of months. Put it like that. Okay, let's look at my cancer. This is the medications that I'm taking right now, and my treatment summary. They don't have anything yet. These are my appointments, and this is the type of chemo that I'm on. Seems that though this is my medications. I'm sorry. I thought this was my chemo drugs. I'm like, wait, that doesn't look right. Yeah, these are the medications that I'm still currently taking, I think. Yeah, this is for like nausea and stuff like that. Okay. But that's what's going on with me. My visits, resources, what resources, hospital locations. Let's see where I go and get treatment. This link for our current hospital locations. This is where I get treated. So if anybody is like wondering, if I have cancer or not, and they don't feel comfortable at all with what I'm saying, because I don't have a whole lot of people helping me with my page. Okay, that's my doctor's office there. You can always come with me to my doctor's office. You know, that would be pretty cool. But I'm getting treated at Rhode Island Hospital. That's where I get most of my appointments set up at Rhode Island Hospital with Lifespan and plan of care. I'm supposed to be actually set up with palliative care. I think I said that right. Palliative care, appointments and visit, upcoming, schedule an appointment, resources, search for providers, hospital locations, settings. All right. Medical history. Let's go look at my medical history. As you can see, like I said, of bipolar 1 disorder. Actually, nope, it's bipolar type 2, not 1. They got that wrong. Maybe I'm gonna have to go and get that fixed. But you can see my medical history: lactose intolerant, PCOS, ovarian syndrome, obesity, weight's coming off. They need to change that. Bipolar type 2, depression, OCD, obsessive compulsive disorder, hypertension, blood pressure's down, personal history of malignant neoplasm. That's my cancer. Anemia, had that most of my life. I think this was a nail fungus that I had really bad, that on my feet, the nails on my feet were actually black. And it's gone. It took a long time to go away, but wow, that medication, boom. You can get rid of a nail fungus. I had to, because it was so painful. I was actually bleeding through my socks. And pancreatitis, that was recent. And actually, this was the time I found out that I had cancer, really. So this is my medical history. I wouldn't lie to you when I said that I do have bipolar disorder, and I suffer with depression, and I have problems with obsessive compulsive disorder, which I think the doctors know how it affects me more than I do, because I don't even understand that. But I will bid you goodbye for now. I've talked too much. And for the people that if you're feeling uncomfortable about making a donation to my GoFundMe page, you don't have to feel uncomfortable. I felt really uncomfortable making it, because I don't even feel like I even deserve to live. But I'm fighting, whether that's my bipolar and depression kicking in. I'm fighting it despite how I'm feeling right now. I'm going to keep fighting until I get home. All right. So I'll come back with an update soon, and let you guys know how my test results came out, and how my visits and chemo and everything went. And, always meet some cool people there. But like I said, if you ever want to meet me there and want to sit down, maybe we can drink a ginger ale, have some coffee, and you can sit in the waiting room with me, or come watch me do my chemo. You are certainly welcome. So take care, everybody, and have a blessed day.